Hello and welcome. Today, we are diving deep into something a lot of people deal with, sometimes without even knowing what it is. We're talking about carpal tunnel syndrome.
So let me ask you this. You ever wake up and your hand is just asleep? You know that pins and needles feeling, and you have to literally shake your hand to wake it up? Well, if you're nodding along right now, you are definitely in the right place, because that's one of the biggest signs of what we're getting into today. So, what in the world is carpal tunnel syndrome? It sounds complicated, but the idea is actually pretty simple. You've got this major nerve called the median nerve that runs into your hand, and it has to pass through a tight little spot in your wrist called the carpal tunnel. When that nerve gets squeezed or squished in that tunnel, well, that's when all the trouble starts. That pressure is what causes all that pain, numbness, and tingling. All right, so here's the game plan. First, we're going to solve the carpal tunnel mystery. Then we'll figure out who's most at risk. After that, we'll break down the symptoms, look at how doctors diagnose it, and, most importantly, we'll talk about your paths to feeling better. Okay, first up, the carpal tunnel mystery. You can think of your wrist like a pressure cooker, and the whole problem boils down to one thing: pressure. As you're about to see, just the way you hold your wrist can have a huge impact on the pressure inside that tiny space. And this chart really just says it all. Look at this. When your wrist is nice and straight in a neutral position, the pressure is around 14, pretty low. But watch what happens when you bend it down. It instantly doubles to 28. And if you bend it all the way up, it skyrockets to 36. That is more than double the pressure on that nerve just from changing your wrist position. It's kind of wild. So that brings up a really good question. Who gets this? Who's most at risk? Well, it's not always a simple answer. It could be your genetics, it could be other health issues, or it could even be the kind of work you do every day. Yeah, your family history can play a huge part. Some people are just born with a smaller carpal tunnel, which doesn't leave a lot of room for that nerve. But a bunch of other things can increase your risk too, like pregnancy, diabetes, thyroid problems, and even arthritis. Oh, and if you've ever broken your wrist before, that can definitely make you more likely to have issues later on. And of course, your job can be a really big factor. Think about jobs that involve a lot of force, like using a hammer all day, or tasks where your wrist is constantly bending back and forth in extreme ways. Even using tools that vibrate a lot, like a jackhammer, puts a ton of stress on that nerve over time. Let's talk symptoms. One really important thing to know is that this stuff doesn't just happen all at once. Carpal tunnel syndrome usually gets worse over time, kind of progressing through different stages, each with its own set of clues. So in the beginning, it's usually that classic thing. You wake up at night with a numb hand and you gotta shake it out. As it gets worse, that tingling starts showing up during the day. Suddenly, simple things like buttoning your shirt or writing become weirdly difficult. And then, in the really advanced stages, you get weakness. You might start dropping things all the time, and you can even see the muscle at the base of your thumb start to shrink. So if you're sitting there thinking, hey, this sounds a lot like me, you might be wondering how doctors figure this out for sure. The good news is they have some really reliable ways to get a solid diagnosis. When you go to the doctor's office, they'll probably do a few simple hands-on tests. There's the Phelan's test, where they have you bend your wrist to see if it triggers your symptoms, or Tinel's sign, where they'll gently tap right over the nerve. They might even just press down on the carpal tunnel for about 30 seconds to see how that nerve reacts. Now that Phelan's test we just mentioned, there's actually two versions. The standard one is where you press the backs of your hands together, flexing your wrists down. But there's also a reverse Phelan's, where you put your palms together like you're praying, extending your wrists up. And as we're about to see, this little change makes a world of difference. So get this, during that standard test, with the wrists bent down, the pressure in the carpal tunnel only goes up by about 4 points. I mean, it's an increase, but it's not a huge jump. Now check this out. With the reverse test, the pressure just explodes to 42. That's more than 10 times the increase. This massive pressure spike is exactly why the reverse test is so much better at bringing out the symptoms and helping your doctor nail the diagnosis. And for the final, definitive answer, doctors have some high-tech tools. They can use an ultrasound to actually look at the nerve and see if it's swollen. Or they can do what's called a nerve conduction study, which measures how fast electrical signals are moving through your nerve. It tells them exactly how much that nerve is struggling. All right, we've made it to the most important part. What can we do about it? Let's walk through all the options on your path to relief, from the really simple stuff all the way up to surgery. So you almost always start with non-surgical options. The number one thing is usually wearing a wrist splint, especially at night, to keep that wrist in the perfect neutral position. Then there's changing your activities to avoid what hurts, using anti-inflammatory meds, or even getting a steroid shot right into the area. And hey, some studies even show things like yoga can help with grip strength and pain.
Now, if none of that is cutting it, surgery becomes a real option. You've basically got two choices, the traditional open surgery or the more modern endoscopic method. As you can see, they both have their pros and cons. Endoscopic generally means a faster recovery, a smaller scar, and you're back to work quicker. But open surgery is usually cheaper, and some data suggest it might have a lower risk for certain specific nerve injuries. It's a trade-off, and it's something you definitely talk through with your surgeon.
And what does recovery look like? Well, after about 10 days, the stitches come out and therapy starts. In about 2 to 4 weeks, you're slowly getting back to light activities. By 6 to 8 weeks, you're pretty much back to normal life. And they say that after about a year, you've gotten all the benefits you're going to get from the surgery.
And I want to leave you with this because it's so powerful. The source material says that even if the nerve damage was really bad, by the end of 1 year, all the benefits of the surgery would have been achieved. That's an incredibly hopeful message for a full recovery.
Which brings us to our last question for you. Are you ready to take the next step for your hand health? If any of this has sounded familiar today, the best thing you can possibly do is go talk to a doctor. Get a real diagnosis and get started on your own path to relief.